Hello, my name's Ivan Bristow and I'm a podiatrist practicing in the United Kingdom. In this short presentation today I'd like to talk about some of the clinical aspects on the use of the new Swift microwave unit in the treatment of plantar warts or Verrucae. This short presentation will represent some of our clinical experience to date with using the device for this particular purpose. The video itself is aimed primarily at podiatrists who wish to learn more about this new device, which is being used, as I say, for this purpose in the treatment of warts. Just before I start the presentation, I'd just like to acknowledge the help of my clinical colleagues who've all been involved in this project. Firstly, Peter Thompson from the Dunfermline Podiatry Centre in Fife, Chris Webb from the Podiatry Centre in Cosham near Portsmouth, and Michelle Score from the Chiropody Surgery in Lymington, Hampshire. The contact details for all these clinics are given in the website below on this slide. I'd also just like to add a little bit of a disclaimer to this presentation, just to say that obviously the information I'm about to give in this short presentation is based on the clinical experience of us as users of the device at this particular time. However, it is acknowledged and highly probable that with further use and clinical knowledge, expansion, experience and research, this may evolve and change, and so some of the suggested protocols may change with time. In terms of what I aim to do in this presentation, I've split it into four sections. Firstly, a very short section on its application and precautions, patient preparation and assessment, patient treatment and review. The good news is that microwave treatment is suitable for most patients we see who have warts and verrucae. Just to point out that a contraindication to the use of the device, as mentioned in the instructions for use in the Swift manual, it's not intended for viable warming. That's known as thermotherapy of tissue, i.e. not as a physical therapy to just gently warm tissue for those purposes. It is licensed as a treatment for skin lesions. When using any medical device, it's important to be aware of the precautions, and with the microwave unit, presence of metal in the foot or ankle is certainly a precaution in its use, as is those patients fitted with a pacemaker device. The other thing to mention is, of course, this is a physical modality which uses heat, so any patients who you suspect of having poor or limited healing capacity, such as patients with neuropathy or poor peripheral circulation, patients who are immunosuppressed, may have a limited capacity to heal. I've also listed pregnancy there because it is known, particularly with HPV infection, that warts are known to enlarge, and resolution during this time can be very, very difficult. So often it's advisable to suggest to patients that if they're requiring wart treatments, to wait until the baby is born before they may undertake any active treatment for their warts. Final thing to say is that, of course, this device does have a little bit of pain associated with it, albeit in very short blasts of 1 or 2 seconds, but patients who've got a very low pain threshold or young children may not be suitable for this particular modality. When a patient presents with a wart on their foot, it's important to prepare them. This primarily would be around discussion of the various options of treatment. As it mentions here, I think there are many ways to treat a wart, as we're all well aware, and it's important before a patient decides that you obviously supply them with a full range of information, particularly around the advantages and disadvantages of each treatment and the likely success rates, remembering that no treatment is 100% successful. And if the patient needs time to decide what treatment they would like to undertake, of course it's good to have some information that can be given to the patient for them to take away before they decide which treatment they would like to have. Once this has occurred, obviously the patient then consent for a particular course of action or treatment. Once a patient has selected to undergo Swift microwave therapy, of course, the next question, if they have more than one wart, is which wart do you treat? and some patients can come in with a numerous number of warts, which you're left as to think which one should we treat first. Clinically, what we have done in the past is treat the largest or most painful lesion first, although it's perfectly acceptable to treat multiple lesions on the same patient at the same particular treatment session. It is purely down to practitioner and patient preference. Lesion debridement is important prior to treatment to ensure the surface of the lesion is level to receive the flat probe. It's also important to make the point that microwaves are not particularly deflected by keratin, but a good debridement may improve the effectiveness of the device. I'd like to talk about now some of the aspects of treatment of the lesion using the device. First of all, the power setting selection. From the work we've conducted for treating plantar warts, we've shown that doses between 25 to 50 joules per application to be appropriate. Now this is calculated by a very simple sum, as you can see here. Typically, for example, a 5 watt by 5 second application would deliver 25 joules into the lesion, whereas 10 watts applied for 5 seconds would deliver twice that amount, 50 joules, to the lesion itself. And that is the basis of how we calculate the dosages for the device. And from the results, the most effective dose seems to be somewhere between those two values. When we normally conduct treatment, we do 3 to 4 treatment sessions, each about 3 to 4 weeks apart, depending on the response of the wart, and that is what we advise patients. I think it's also important to say that larger or more numerous lesions may require more applications, so when you're assessing patients and discussing swift treatment with them, if they do have lesions larger than 15 millimeters or so, they may require more applications, although they still respond to swift in a similar way. And where there are lots of lesions, we've treated patients with sort of 30 or 40 warts, they may again need more applications, but it's important to advise the patient of this. The probe itself is 7 millimeters in diameter. Therefore, if you have a wart which is in excess of 7 millimeters, you may require a number of applications in one treatment session. So simply, these can be applied side by side so that the bulk of the lesion, as illustrated here, can be covered during the treatment session. So this lesion here could have a dosage of 25 to 50 joules 4 times over the surface of the lesion to cover the bulk of the tissue. The next thing to discuss is pain, and obviously one of the main questions that people will have if they're undergoing any form of treatment is, will it hurt? And I do spend a lot of time with patients because I think it's important to describe the likely pain that they're going to experience as a result of any treatment. Again, drawing on our clinical experience from treating many patients for a standard 5-second treatment, as the clock counts down from 5 to 4 to 3, most patients will begin to feel a little bit of tingling at 3 seconds and an increase in pain until the application ceases. So for most patients this is around 2–2.5 seconds of pain, which can certainly make them jump. Most people describe it as a sensation which is like treading on a needle, and yes, it is uncomfortable, but most patients will also say the good news is that once the swift treatment times out and it reaches 0 on the clock and the microwave energy ceases, the pain subsides significantly, in most cases to a very dull ache. Also, conversely, we have treated patients who feel very little at all, and certainly this is something we've observed more so with lesions on the plantar heel pad, but most patients will feel something. Some patients describe it as minor, but most patients will say yes, it's painful, but a very short pain of about 2 seconds in most cases. In terms of post-operative care, there are very few things, that's the beauty of microwave therapy, that you need to discuss with the patient, or the patient in fact needs to do. I think the first thing to explain to the patient is that the pain they may experience after treatment, and as it says here, a small number of patients may experience some pain or throbbing in the following 24 hours or so, and for these patients normal analgesia, which they take for a headache, is usually sufficient. Most patients will be able to carry out their normal job and activities after treatment, but may be aware that it's a bit sore for 24 hours afterwards. In terms of what the patient has to do, there's very little. The only advice I give them is to say that this lesion is likely to go very dark in colour, forming a small bruise or a deep hematoma within the treatment area, usually within a week or so. And for most patients this is not uncomfortable, but they're just aware that the lesion has gone very dark. During this time there's no need to avoid showers and swimming, and the patient can do everything that they do normally, and we would suggest that patients be reviewed roughly at about 3 to 4 to 5 weeks to assess their progress and to consider if another treatment is required. This is just a clinical slide to show the formation of hematomas, and this was in a patient 2 weeks after they had the Swift treatment, and they were completely painless, but the patient was aware they had appeared. Again, I think it's important just to describe this is likely to happen in patients, otherwise they worry that the lesions have gone black. So in terms of review, patients normally can be seen, as I said, at 3 to 4 to 5 week intervals, depending on your own clinical judgment and the patient's availability in many cases. And I would say lesions can resolve after 1, 2 or 3 or 4 treatments, we found, though the average time for resolution of a smallish wart is about after 2 to 3 treatments. As I said, larger warts would take longer. The other anomaly which we've noticed is that when you have a lesion which is undergoing treatment, they don't appear to shrink during the course of treatment, but rather they become thinner or debulk. So explaining to the patient they may not expect to see the lesion shrink before their very eyes during the course of treatment, but what they do is become much thinner as time passes by and treatment progresses. The other thing is, where lesions are responding and they're becoming thinner, then certainly you can review the power setting based on the patient's response and reduce it accordingly if the lesion is becoming thinner, or you may wish to continue with the same power setting, but that is purely a clinical judgment. Finally, clinical experience that we've had certainly shows that lesions may resolve up to 2 to 3 months after the last microwave treatment, so patients should be advised that this may occur if it has not responded after the usual 3 to 4 treatments. So in summary, this has been a short presentation discussing some of our clinical experiences of the Swift device, which we found to be effective in the treatment of plantar warts. And our use to date has suggested up to 4 treatments using an energy dosage somewhere between 25 joules and 50 joules of energy to be somewhere around about optimum. And lesions typically show extravasation after treatment, and from the patient's point of view, significant advantage is that there's minimal post-operative care required, although a small number of patients may find the treatment briefly painful with soreness in the following 24 hours. I hope you found this presentation useful, and thank you for listening.